I never thought I'd be making this video, especially after everything I was told, and of course told you. Something unexpected happened. I'm pregnant! Yes! She asked me how long. I'm like, I don't know, 6, 7 weeks? For the past like 10 years, I've had an IUD because medicine. That was our plan. Plans. Oh, medicine in our plans. Plans are planning for the unexpected. If you're new here, my name is Dr. Moss, a psychiatry chief resident for medical student education and wellness, someone who's always shared the humanistic side of being a patient and a doctor. So today, I want to talk about something deeply personal and honestly still surreal, which, if you know my story, this is about infertility, fertility, identity, fear, healing, and honestly, a pregnancy I did not think was naturally possible without medicine and science. So make sure you stay for this story and journey. So let's go backwards now. Oh my goodness. I'm a second year resident. So that's a leave of absence, 2 years, and then 2 years. So 5 years? Wow. Yeah. No, 5 to 6 years actually. I learned, you can see my other videos, but I finally was diagnosed through a surgery with endometriosis. And during that procedure, my OB-GYN was really nice in that she did a procedure that normally they don't do until people are wanting to become pregnant. But because the risk is so high, I believe 60% usually have some sort of tubal occlusion, whether that is because of scar tissue, inflammation, and they did it and both my fallopian tubes are clogged. So that's what I knew. That's what I told you. That's the mindset I have been for the past 6 years. I'm infertile. I need science. Obviously, it became part of my identity. If you see my other videos, I went through IVF preservation because, we're medical students. You have a problem, let's fix it. So my fix it was to grab my eggs and freeze them because in the future I want to have children. I didn't even think I wanted to have children at that point because I was so focused on USMLE step one at that point. I had to take a leave of absence, like, oh, so much stuff. And COVID, my goodness. Yeah, it was the first year of COVID, 2020. It really did become my identity, and I just had to persevere. I started the egg stimulation and freezing, which I did twice, and I knew that I couldn't afford mentally, physically, financially kids right now. My husband was in medical school with me, so we definitely couldn't do that. Our families are in Colorado, so not even in Illinois with us. So we're like, nope, can't do it. And honestly, this is not an uncommon situation. Infertility is very prevalent in medicine. Up to 1 in 4 female or biologically female physicians struggle with infertility. By the time they want to have kids and start thinking about their fertility, it becomes too late and they struggle with infertility. The majority end up having to go towards IVFs. And so you can see my other videos, what that looks like. I talk a lot about infertility, education and things like that. It's not something we talk about, which is so frustrating. And it seems to be my niche and thing that I talk about the human struggles of medicine. Maybe that's why I chose psychiatry, right? There's no reason to hide if this is just a normal human experience. Hopefully, by me sharing my story, you feel less alone in whatever you're struggling with. I had to go through pretty much hell, whether that's USMLE failure, taking a leave of absence, infertility, IVF, all those things take from my lessons and examples. It is so emotionally heavy, and I've since been notified by so many people who've heard my story and listened to my story in and outside of medicine who have endometriosis or a friend, because it's 1 in 10 who have endometriosis. That's quite a bit of people in the world, and like I said, very common infertility or struggles with fertility. You know what? I really don't like infertility word. Yeah, because that was my problem. I identified as infertile means I can't have kids, that I'm broken. Obviously, I got pregnant. Huh. Struggles with fertility, but everyone does. And I think that's also why I love medicine. Everyone has some sort of mental or physical health struggle at some point in their life because that is human. That's why I went into medicine and stayed in medicine to talk about that. It is real and it is normal. It's not something we should hide or take it as a personal problem. And I'm not saying like I did it up to literally, we'll get to it, of how this past 2 weeks has been, which has been horrendous. These past 2 weeks have felt like months. But anyway, let's get to. So I froze embryos. My hope was after residency, after fellowship, just whenever we felt we were ready to have kids, financially, mentally, and physically safe. But then I'm in residency. I'm a second year. My husband is a third year. And you know what? This is also what did it, what changed the conversation. My husband was offered a job 2 years before he's an attending. Well, I guess it's a year and a half. I'll take that back. A year and a half. Because that's how they do it in neurology. They either apply to fellowship or they start looking at jobs. I know, not during their fourth year, during their third year. Super early, but he got offered a phenomenal attending position in a private practice that he can go towards a partner position. So huge financial even bonus, exactly what he's interested in doing. He almost went into fellowship for epilepsy, but this ended up being perfect. And he can keep doing his AI research in neurology medicine and bring what he's good at. Okay, so residency was our spot, and I'm done at this point with all my USMLEs 1, 2, and 3. I finally, after struggle, if you see my other videos, failure of step 1 twice, passed step 2. Step 2 was the only one I passed first time. Step 3 failed, but once and then passed. So done with those. Then we started thinking, once he got a job, we were like, what if we wanted to start becoming parents, or at least expanding our family? We've been married for over 10 years. Even that big one over there, I was going to say little one, but he's not little anymore. I had talked about this before, that my husband is 70, 80 hours in residency. I barely hit 40. Sometimes on a bad week, it's 50 when I'm on call once, maybe twice a week, if that happens. So I have all this free time. And so far in my education, I chose to be a chief resident, educate medical students, making these videos, helping people with applications, doing things for others. And I'm going to be selfish, which is funny to think about it. And that's definitely a trauma response for me. Help others, give the trauma response of, it's not fight. It's not, well, sometimes I do fight. A little bit of fighting for people and what I believe is right. Flight, definitely not flight. Freeze, not freezing, thankfully. Submit, not really, no, not submit. Fawn. I've been fawning a lot. Giving, trying to give as much to others to make myself feel worthy of being alive, of being a resident doctor, a wife, a sister. Goes to imposter syndrome, which I always think it's going to get better, and it has gotten better. But through taking a step back to focus on me, that's what this child is going to be. Because I more just change my energy, take care of myself and this baby. Of course, I'll still be a psych resident. I'll be making videos of this journey, so don't go away. But maybe it might just be a shift on what I'm doing. Maybe not as many interviews, which I kind of been going away. We still have 10 interviews I had done that I'm gonna publish. So if you're a medical student and want to help edit and publish them, that's a great opportunity to show the humanism in medicine. We'd love to have you. But yeah, it's gonna be a redirection and a new season, and that's okay. And know what that is something I've had to learn in medicine of being, they're just different seasons and chapters of my life. I've also started writing my book again, which I first started during my leave of absence to try to document my journey because that was the first way that I could think to express and get through medicine, and then transition to these videos. Right now, my schedule, our life feels safe physically and emotionally. I'm a chief resident for wellness. So, like, I advocate and I live in wellness space. So, my mind and body were in such a good place. That's why I believe I got pregnant. It makes sense from a medical, biological, and psychological state because when you're under extreme amount of physical, financial, emotional stress, your body's going to be high cortisol, inflammation. This is why what the OB-GYN said is that when they did the evaluation of my tubes, I was in the leave of absence. I was in a lot of stress during my second year of medical school. COVID had just started. A lot of stuff was going on. It was my first surgery. It's very possible my fallopian tube spasmed under a lot of inflammation at that point when they were testing. It was the fact that I'm now not in physical, emotional stress. I've now gone on a really good medication regimen for my mental health, for my PTSD, anxiety, and even my physical symptoms of endometriosis. I've learned to manage them. They just came out with a study this morning of how exercise and psychotherapy or psychopharmacology were equal for depressive symptoms. I thought that was amazing. We've seen how much exercise and movement of the body is something that's so important for being able to be mentally, physically healthy, being able to be fertile, being able to conceive. So that's kind of where we're at a month and a half ago. We were like, okay, remove the IUD and we're going to start the IVF process, like getting my cycles back to normal because I didn't have any cycles at all for the past like 10 years because I've had an IUD because, medicine. But that was our plan. Plans. Oh, medicine and our plans. Plans are planning for the unexpected. But yes. Okay. So we decided, okay, let's see if I can naturally conceive. I didn't like that idea because I was still set on, nope, I'm infertile. I cannot conceive naturally. I was rewatching my IVF videos I created. So, with no expectations, no stress, I started feeling pregnant and side effects during Christmas vacation. Huge emotional roller coaster. I completely broke down. Like, I normally break down during holidays, which is normal during the holidays. As a psychiatry resident, that's when the holidays are the worst in the emergency room. We see a lot of people that come intoxicated or just struggle a lot during the holidays. So that happened to me, but not to this level. I fully broke down, bawling in a ball, crying, blanket around me. I tried everything. I tried the breathing techniques. I texted my two best friends, that three, I think even. It was just a mess. And then I was getting like on and off nausea, but we, my husband's not gonna like this, but he wouldn't, I don't like the word he wouldn't let me test. I could have done it, but I still appreciate his concept that I was supposed to let it go during the holidays and not worry about it. The worst thing you can do to someone is say, don't worry or calm down. Anyway, the moment we got home from the holidays, boom, I did a test and pregnant. Two stripes. How? What? Two stripes? Like I had already done it. Like I was planning on doing ovulation. Like I did both I did urine streak of two because science. I love science. I was having so much fun. I felt like I was back in organic chemistry or biochemistry. So I was expecting ovulation to be positive. So I just did both just in case. Up to that point, before we had gone on vacation, I had kept testing negative for ovulation and obviously pregnancy. I was thinking about tracking, even though my husband thought it would cause me too much anxiety. Of course it did. But of course, medicine and us, type A. But yeah, what else? I freaked out, panicked. Then I did a second time. Again, positive. Second panic. And then the rest of the week, it felt forever because we were hiding it because we had told the family that we were going to do IVF here soon. That's why we couldn't have alcohol. That's why we couldn't do all the things we learned in med school. I did start on prenatal vitamins the moment I got my IUD out. I was doing everything by the medicine book. I even got what to expect when you're expecting, like any doctor and anyone who knows me in person or through videos. That is me. Over control. I take full acknowledgement of that. But honestly, it was excitement, but it was literally just absolute terrifying fear. I've been in this past 2 weeks of terror. The best way I can think of it is like when you don't know if you passed a USMLE exam. That's what level I was in. And I was panicking. And the reason I was panicking, so set on like, I'm infertile, remember? Tubes clogged. There's no way, nope, this has to be a mistake. There's no way I'm pregnant. Well, no, I'm pregnant. I know beta HCG in urine's not gonna lie, but it can still be a topic and it's most likely a topic. And so that's the mindset I've been freaking out in, even though my therapist, my husband, has been like, no. And the couple friends that I told are my emotional supports. They're like, you don't know. But yes, that has been my terrifying panic over the past 2 weeks. I had, and this is also a trauma response of PTSD. You go through all the worst things that could happen, and then you pre-plan how you're going to deal with them. So that's exactly what I did. Okay, well, if it's heart's not missing, boom. If it's a topic, boom. If it's a miscarriage, boom. This is how I'm going to mentally think. This is what the side effects of that going to be. These are what the medicines are going to be. And I tried. I did. I've been doing Orange Theory. So let me know if you've been doing Orange Theory too, because I finally have the money and it's been so good for me. And again, exercise, healthy. That also helped me conceive. This is not a how to conceive video. I'm a psychiatry resident. Even though I'm a medical doctor, this is not medical advice. Just my experience with the knowledge of science and medicine from medical school. Talk with your own doctor. Up until last night, I kept myself busy. I was on call, which I was fine with. I enjoyed. I purposely chose to be on call. Keep my mind busy. Kind of worked. I was so thankful I didn't even have difficult patients, even though I still had a couple ER consults that were actually unique and fun. And then I had a psych crisis, but it wasn't bad. I got to sleep, not as many hours if I wasn't panicking. Oh, and I forgot my magnesium. I can't take my gabapentin for my restless leg anymore because of pregnancy. Restless leg last night, that was not fun. I'm gonna be honest and tell you everything. Oh yeah, and then I texted my friends. I love this new phrase. I'm gonna totally use this for my patient. Emotional contingencies. 9 a.m. tomorrow. This thing could turn out bad. I need someone who I can visit while my husband's at work. It was kind of a safety plan. Huh. That's a really good point. Because mental health is so important and so impacted through fertility, infertility. And that's why we have postpartum, prepartum depression. And I know I'm at risk because I have mental health conditions myself and have had suicidal thoughts in the past. Even though I was mentally prepared for if it was a topic or non-viable and still am, it's good that I reached out to family, friends to prepare. Something's going to happen tomorrow. I need your support. And thankfully they did. And I think that is a really great lesson for my patients and others. If you know you're going to go through something very stressful, like finding out whether or not you passed an exam or something you're looking forward to, and there's like that risk, having someone who knows this is a big deal, no matter what the outcome is, to make sure they'll be there and they'll be checking in on you, that could be so important to reducing suicides, honestly, of just knowing you're not alone, that people will love you and support you no matter the outcome. And that's why I'm also really open to sharing all this experience throughout this journey. Like, I'm early, I am. Oh, we'll get there, we'll get there. Oh, something I learned that I feel really bad about. I assumed my husband, because he couldn't, I didn't think he would want to come, but he did. And I know that his residency, they can't really take time off, even for sick or wellness, but he was able to finagle and asked for permission. And of course, they let him. So he came, picked me up from being on call shift, and we drove down. We were bad patients, arrived 10 minutes late, which I was defensive. And I was like, I was on call. But yes, I wouldn't have liked that if a patient. I was anxious, and that doesn't excuse me, and I apologized. But anyway, so the poor nurse, she's trying to get all my information. And of course, me being a doctor and already using my phone, I'm like, okay, this date was this, IUD removed here, negative ovulation this day, found out pregnancy here. I had a spotting, actually. That's when I thought the period was starting. I'm like, finally, yes, I haven't had a period in 10 years. But then it went away after a day. It was implantation bleeding. So I was like, oh, that's how I might be pregnant when it attached, because you can conceive within 4 to 5 days before it actually attaches. Don't quote me on that. I'm not an OB-GYN. Kind of remember. But yeah, and the nurse was like, yeah. And also when I called them originally, freaking out, they're like, we don't normally do ultrasounds until 6 weeks. I'm like, can you just get me in there and do a beta HCG blood level? Like, please. Or ultrasound, I just need to know whether this pregnancy is true, and two, if it's a topic or not. I didn't even consider, I barely even thought about the concept of it being in my uterus. Like, that's how much I didn't even trust. But I let it go. And literally, from the moment they put the ultrasounds, it was literally even on top. They started with, before intravaginal, they just did on top to see if they would see anything. And like, even the ultrasound's like, we're not going to see anything if something's there, because we don't know how long. Because, oh, this is my favorite. She asked me how long. I'm like, I don't know. 6, 7 weeks? Really? It was 5, 6. Had to do that. You have to have some happiness. Anyway, so yeah. She literally put it on and we just see a bubble. And my husband and I were just like we couldn't believe it. Like, we're both in medicine. We've both seen ultrasounds before. We both did our OB-GYN rotation. We knew that was a very chubby, very big uterus, that my uterus is not that big normally. I don't have adenomyosis. I know that. Usually, uterus is not that big. And there was a little sac. So, urinated, remove all the urine, and did the intravaginal ultrasound, and right there was our little sac. I call it a nugget. Husband Jonah calls it a creature, nugget creature, but is right now about the size of the sweet pea. So today we're a sweet pea. So that's what letting things go to higher power for me and God, and just letting my body and things be as they are. We zoomed in and you could see the heartbeat, which it's not a real heart. They're tubes. It's just we boom, boom, boom. They're not even pumping. It did mean something else. In 2 weeks, I have another appointment where I'll actually be able to hear. And yeah, viable pregnancy. And of course, my husband is a neurologist, neurology resident, so he's ecstatic that neural tube is closing, if you remember, and building that little brain. So my body, despite everything, I'm doing this. Let me say, these side effects, it isn't a fairy tale. Of course there are side effects. Anxiety, disbelief, nausea, emotional roller coaster, but gratitude and respect for the body, that my body's finally doing what it's supposed to for once, and how it can be. And I know I'm not broken. Even if in the future things don't go as planned and I have to try again, or I have to use my embryos that are frozen, it'll be okay. That is natural, just a human experience. And I hope you can join me on this journey, this new chapter, this new season in my life. Thank you for the ones who've joined me from all the way at the beginning of being a med student, then a resident, and now a resident with a baby. So please comment what you want me to share. What would you be worried about? Or what do you want to know? What about pregnancy and residency, scheduling maternity, paternity leave, accommodations for maternity? I did a video on that already, but I will be specific. And then, of course, I'm a psychiatrist, the emotional side. Of course, I'm going to be sharing the emotional side, even when I get there, of what it is, because it's huge and we don't talk about it during fertility, future miscarriages, or future mental health struggles. I believe very strongly in being open and vulnerable and sharing the human experience, because I'm human and so are you. And you are not alone. And I'm so excited to have you all on my journey with me. I will put, if you're interested, no pressure. If you want to support us, I put our Amazon baby registry where, of course, we have tons of books. And of course, don't care, we will not recommend medicine, but that's a whole nother story. I've linked my Amazon registry in the comments, and if you're interested, but whether you're in medicine or outside of medicine and you're struggling with fertility, or you're thinking about it for the future, or holding in grief quietly, I see you and you are human and we will get through this. I hope that this story, I know it won't erase the pain, but it reminds that our bodies, timelines, lives don't always follow the perfect algorithm or plans that we hope, or what we're taught in medical school. But thank you so much for being here. This is Dr. Moss from Life as a Patient Doctor. I will be moving some of the previous videos to a new podcast specifically focused on medical school, and the new podcast Flying to Residency, and now one specifically for residency life. So if you ask, like, what happened? Why aren't you posting to Life as a Patient Doctor? That's going to be the new seasons. I'm taking episodes from that one, updating them and moving them to those set podcasts. So make sure you subscribe on wherever podcasts, Spotify, Amazon, wherever you're at, on one that you're interested in, and share it with your friends. I appreciate all of you. Thank you for being with me through this journey of medicine and life as a patient doctor. Take care, everyone.